10 Rare and Horrifying Neurological Disorders. The nervous system, which includes the brain, spinal cord, and nerves, can be impacted by a variety of conditions known as neurological disorders. These disorders can have a significant impact on a person's life, causing changes in movement, sensation, and cognitive function. Although some neurological disorders, such as Alzheimer's and Parkinson's disease, are widely recognized and discussed, there are numerous rare and alarming disorders that are not well known. These disorders range from debilitating to downright terrifying, and are both captivating and devastating. Number 10. Alice in Wonderland Syndrome, AIWS. This neurological condition, also referred to as Cotard Syndrome, is named after the Lewis Carroll book, Alice's Adventures in Wonderland, in which the protagonist, Alice, undergoes numerous surreal changes in size. The disorder is marked by perceptual distortions, including alterations in body image, size, shape, and color of objects. Individuals with the syndrome may experience micropsia, where objects appear smaller than their actual size, or macropsia, where objects appear larger than they are in reality. They may also perceive sounds as louder or quieter than they are and experience distortions in time perception. The precise cause of this syndrome remains unknown, but it is thought to be associated with various factors, such as migraines, epilepsy, infections like infectious mononucleosis, and the use of hallucinogenic drugs. Although this condition can affect individuals of all ages, it is more prevalent in children. According to some available research, up to 30% of teenagers may experience brief episodes of AIWS symptoms. However, further research is necessary to validate this and to determine the underlying reasons. AIWS is not extensively researched because it is typically a temporary condition. Many of the root causes of AIWS are also short-lived, resulting in brief episodes of symptoms. In fact, between 1955 and 2016, only a small number of cases, less than 200, were severe and prolonged enough to necessitate direct medical attention. Number 9. Cotard Syndrome. Cotard Syndrome is a rare mental illness that is characterized by a delusional belief that one is dead, non-existent, or has lost their internal organs or blood. The condition is named after Jules Cotard, a French neurologist who first identified it in the 1880s. While symptoms of Cotard syndrome may differ from person to person, some common symptoms include depression, anxiety, self-neglect, delusions, and hallucinations. In some cases, individuals with Cotard syndrome may even reject the existence of God or the devil. In severe cases, they may refuse to eat or drink, as they believe that they do not require sustenance since they are already deceased. Although the precise cause of Cotard syndrome is not yet fully comprehended, some researchers suggest that it may be due to a combination of biological, psychological, and environmental factors. Possible causes include brain damage, bipolar disorder, schizophrenia, and drug abuse. Since Cotard syndrome can be triggered by various conditions, there is no one-size-fits-all treatment for all cases. Some treatments that have demonstrated encouraging outcomes include antipsychotic medications, antidepressants, psychotherapy, and even electroconvulsive therapy. Number 8. Foreign Accent Syndrome. Foreign Accent Syndrome, FAS, is a rare speech disorder that causes an individual's speech to sound as if they have an accent from another country. Although this may not appear to be particularly alarming, the disorder can be caused by a variety of frightening and life-altering factors, such as stroke, brain injury, or neurological conditions like multiple sclerosis. In addition to the most apparent symptom of FAS, which is the development of a foreign accent, other symptoms may include difficulty with speaking and pronouncing words, changes in intonation and rhythm, and difficulty with word choice and grammar. Since its initial report in the 1940s, there have been only around 100 documented cases of FAS. One of the most well-known cases involved a Norwegian woman who was struck by shrapnel during World War II, resulting in her developing a German accent. Another case involved a woman from Devon, United Kingdom, who acquired a Chinese accent after experiencing a migraine, and a British woman who, after suffering from a stroke, began speaking with a French accent. Number 7. Alien Hand Syndrome. Alien Hand Syndrome, ALS, is a rare neurological disorder that affects the control of limb movement. It is also referred to as anarchic hand or Dr. Strangelove syndrome. Individuals with AAS experience involuntary movements of one of their hands, which appears to have a mind of its own. The symptoms of AAS can differ from person to person. In most instances, the affected hand will perform actions that are contrary to the person's intentions. For example, the hand may reach out to touch something the person wants to avoid. The hand may also undo buttons or zippers or even strike the person's face. In some cases, the affected hand may have a tendency to grasp objects and hold them tightly, making it difficult for the person to release them. AAS is a neurological disorder that is typically caused by brain damage, often resulting from surgery or injury. This damage can disrupt communication between various parts of the brain that regulate limb movements. In certain instances, AAS may be linked to other neurological disorders, such as epilepsy or dementia. In a troubling case, a 77-year-old woman reported that while sitting and watching TV, she suddenly observed her left hand moving independently. She was unable to control it and stated that it continued for almost 30 minutes, even stroking her face and hair. Number 6. Mirror touch synesthesia. Mirror touch synesthesia is a captivating neurological condition that has garnered more attention from researchers in recent years. It is classified as a type of synesthesia, which is a condition where the stimulation of one sense can lead to the stimulation of another sense. In the case of mirror touch synesthesia, individuals can experience the same sensation as another person, even if they are not physically being touched. For instance, seeing someone else being touched or feeling a sensation can trigger a physical sensation in the person with the condition, such as a tickling or tingling sensation. The intensity and duration of this condition can vary, with some individuals experiencing brief sensations and others experiencing more prolonged ones. Some research has raised questions about whether individuals with MTS synesthesia are more empathetic than those without the condition. Several studies have demonstrated that individuals with MTS may exhibit heightened empathy, resulting in more altruistic behavior. Additionally, research from 2018 suggests that MTS can increase emotional reactivity and enhance the ability to recognize emotions. Number 5. Prosopagnosia. Prosopagnosia, commonly referred to as face blindness, is a rare neurological disorder that impairs an individual's ability to recognize faces. The condition can be caused by brain damage or may be present from birth. Damage to the brain's fusiform gyrus, which is responsible for facial recognition, is the most common cause of prosopagnosia. However, some people are born with the condition, which is believed to be caused by a genetic mutation. Individuals with prosopagnosia can still see and perceive facial features, but they are unable to connect them to a specific person. They may also experience difficulty remembering the faces of people they have met before, even if they have known them for a long time. Some people with prosopagnosia may also struggle with recognizing other objects, such as cars or buildings. The exact prevalence of prosopagnosia is not well understood by experts. Some studies suggest that up to 2.5% of individuals have congenital prosopagnosia, also known as developmental prosopagnosia, to some degree. Number 4. Fibrodisplasia ossificans progressiva. Fibrodisplasia ossificans progressiva, FOP, is a rare genetic disorder that affects approximately 1 in 2 million people worldwide. It is also known as Stone Man syndrome, and is characterized by the progressive formation of bone in muscles, tendons, and ligaments, leading to restricted movement and, eventually, complete immobility. The disorder is caused by a mutation in the ACVR1 gene, which provides instructions for creating a protein involved in the development and maintenance of bones and other tissues. The mutation causes the protein to become overactive, leading to the formation of extra bone in the soft tissues of the body. Unfortunately, there is no known cure for FOP, and treatment options are quite limited. A recent study has revealed a concerning fact that there is a high rate of misdiagnosis worldwide, with incorrect diagnoses accounting for approximately 90% of cases. This alarming statistic is compounded by the fact that a staggering 67% of patients undergo invasive diagnostic procedures that may actually do more harm than good. One can imagine the physical and emotional toll this takes on patients, who may endure prolonged suffering and may even be subjected to unnecessary treatments. Number 3. Klein syndrome. Klein syndrome, KLS, also known as Sleeping Beauty syndrome, is a rare neurological disorder that primarily affects adolescents and young adults, with about 1 to 2 cases per million. Its symptoms include recurrent episodes of excessive sleep, altered behavior, and cognitive disturbances. During these episodes, individuals may sleep up to 20 hours a day, with a decreased need for food and water. Other symptoms of KLS may include altered behavior, such as impulsivity, irritability, and hypersexuality, as well as cognitive disturbances, such as confusion, disorientation, and memory loss. KLS affects people for a short period, typically lasting from a week to a couple of months. During the periods between episodes, the person does not exhibit any symptoms. The causes of KLS are unknown, and there is no cure for it. The person may experience several episodes every few weeks or months, and KLS can last for 10 years or more before resolving on its own. During episodes, about 50% of patients displayed symptoms consistent with hypersexuality. These symptoms were more common in men than in women. In males, symptoms included increased or overt masturbation, exposing oneself, using obscene language, fondling genitalia, and making unwanted sexual advances. In certain instances, these unacceptable sexual advances involve the assault of female nursing personnel, female guests, the patient's female siblings, daughters, or other female family members, and in 3 cases, another male. Along with sexual urges, some patients also exhibited compulsive behaviors such as singing, body movements, lip biting, writing on walls, removing wallpaper, and having an urge to start fires. Number 2. Witzelsucht. Witzelsucht is a condition characterized by the excessive telling of pointless or inappropriate jokes, commonly known as pathological joking. The term is derived from the German words for joke, witz, and addiction, sucht. In 2016, California-based doctors Elias Granadillo and Mario Mendez conducted a study on this condition, documenting 2 cases. One of the cases involved a 69-year-old man who had suffered a brain bleed 10 years prior and experienced a personality change, compulsively making jokes. He also exhibited behaviors such as a fixation on recycling and making borderline offensive comments. During an interview, the patient expressed happiness but also concern about his compulsive need to make jokes. Despite the humorous nature of the interview, the patient acknowledged that his behavior had become an issue with his wife, often waking her up in the middle of the night to tell jokes. During an interview with a second patient, a 57-year-old man reported exhibiting erratic behavior 3 years prior to the study. He developed a habit of telling childish jokes and laughing uncontrollably at his own comments. Additionally, he showed a lack of inhibition and purchased almost 24 Hawaiian shirts. He also went 6 weeks without bathing. The patient had an unremarkable medical history and mostly normal results from a neurologic examination. However, he experienced a decline in cognition and developed Parkinsonism, eventually passing away more than a decade later. According to the authors of the 2016 study, the pathological humor exhibited by both patients was linked to damage in the bifrontal regions of their brains. Interestingly, both patients found their own jokes hilarious but failed to find other people's jokes amusing, a commonality that was both significant and ironically funny. Number 1. Jerusalem Syndrome. Jerusalem Syndrome is a collection of mental phenomena that can be triggered by a visit to Jerusalem, characterized by religiously themed obsessive ideas, delusions, or other experiences that resemble psychosis. It has been observed in individuals from various religious backgrounds, including Jews, Christians, and Muslims. In the past, Jerusalem Syndrome was more prevalent, with approximately 50 cases per year, leading to the establishment of a psychiatric hospital in Jerusalem as the designated treatment center for affected tourists, primarily Christians. However, reported cases of the condition have decreased over time. In a 2011 interview, a hospital psychiatrist stated that they only saw 2 or 3 cases per year. A peculiar incident took place in the Old City of Jerusalem when a man from the Midwest was discovered wandering around in a white robe, proclaiming to be the Apostle Paul. This individual was detained by the police and transported to a nearby mental health clinic after attempting to impose his beliefs and practices on observant Jews and Muslims. Another well-known case involved a man who thought he was John the Baptist and was discovered wandering naked in the desert, attempting to baptize people he encountered before being detained by local authorities. The majority of patients who experience this detachment from reality are Christian pilgrims who are deeply religious, typically Protestants from rural areas. They are usually middle-aged and inexperienced travelers, and this is often their first trip abroad. After years of studying the Bible, they have an idealized image of Jerusalem that does not align with reality, resulting in a temporary mental breakdown. Thanks for watching.